Good morning, and first of all, a huge thank you for asking me to come along today. And there's one other thing I was wanting to clarify. My preference, particularly at events like this, and people with expertise like yourself, is to be called Joe. And Paul often calls me Mr. Fitzpatrick because that's the formalities of government, but my preference is to be called Joe, and I hope that helps make it easier for you to approach me and whether as part of today's debate or at other times as the Minister with responsibility. I'm really, really keen to hear your experiences to make sure that any actions we are taking as a government are properly informed. So, as the new Minister for Public Health, Sport and Wellbeing, I have been looking forward to this, my first Carers Parliament. I had the honour of attending and the privilege of attending the Carers Festival earlier in the year, the Young Carers Festival earlier in the year, and that helped me understand the need for me to come to more of these events and hear more from the individuals. The young people that were there were amazing individuals and helped me to understand a bit more about my responsibility as the Minister with responsibility. So it is really encouraging to see so many people and so many carers here of all different ages. So there's the young carers and there's everyone else, and from all parts of Scotland as well. And undoubtedly you will have a range of caring situations and experiences. So I'm, as I said, really keen to hear about the issues impacting on your lives as we debate the way forward for Scotland. There are a number of MSPs who I'm not sure they're here yet, but who are planning to come along at some point today. There's organisations and there are a number of officials from Scottish Government and local government here as well. And they have an interest also in what you think the future of our health and social care should look like and what needs to be done in order to make that a reality. So we're really keen to hear your views and ideas in this morning's debate. I also want to give a warm welcome to our guests from carers organisations in Belgium, Italy, Finland, Sweden and Norway. And I hope that we'll have an opportunity to learn from each other today so that we can help each other to find the best way forward. I think we're making some fantastic progress here in Scotland, and I hope that our colleagues from elsewhere in Europe can learn from that, but I'm sure that there's things that we can learn from those colleagues as well. So let's make the most of that opportunity having those friends in the room today. So today's debate is about the shared challenge of shaping our approach to social care and health now so that it's fit for the future, and the importance of carers in helping us get that right. But before we look forward, I want to take a moment to look back. So at the Carers Parliament 3 years ago, the First Minister spoke about the Scottish Government's pledge to use the new powers of the Scottish Parliament to establish a social security system based on dignity and respect. And the Cabinet Secretary for Social Security will be speaking later today about the positive changes that have been made to the carers allowance and the development of the Young Carers Grant. You'll hear a lot more detail later, but I just thought wanted to take the opportunity to emphasise that the voices of carers and carer organisations continue to be a central part to shaping policy in that area. I've been told that there is a Young Carers Grant consultation workshop on the programme this afternoon, which is great to hear. And on the theme of carers' voices, the First Minister also spoke about how carers' wealth of knowledge and experience made a real difference to the development of the Carers Bill, as it was at the time through the consultation and forums across the country. So the Carers Act, as it is now, which took effect in April, has put in place a system of carers' rights to make carer support more consistent and personalised to individual needs, to help protect carers' health and well-being and sustain caring relationships. The Act gives every carer the right to have their individual goals and needs identified and the right to support to meet any eligible needs. The Act also includes duties on health boards and local authorities to involve carers in decisions about carer services and in hospital discharge of the person or people for whom they care. And each local authority must produce and publish a local carer strategy, which will set out, amongst other things, an assessment of demand and plans for supporting carers. The Act also requires carer information and advice services in every area, which must cover important topics including carers' rights, benefits, emergency care and planning. So while the Carers Act is an example of a significant step in the right direction, I think it's important for government to accept that there are many challenges still facing us. As a population, we're enjoying longer lives, and with that comes often more complex care needs. That means demand for social care and support is growing faster than our traditional services were designed for. So we need to think differently about what care is and the value we place on it as a society, and how people can access the support which is right for them. What reforms look like is something we must work on together. While reforming social care so that it's fit for the future is a huge challenge, there is innovative work already going on at community, local and national levels that together we can support and build on. Local areas are making progress in developing new creative models of care that fit with the needs of their communities, and are working together with communities to develop their local capacity and resilience. Nationally, we're implementing Frank's Law, which means that by April 2019, people of all age groups who need it can access free personal care. And we've recently announced our commitment to accelerate efforts to ensure that the widely supported aims of integration of health and social care translate into positive change in every community. However, there's more that needs to be done to make sure that the good work that continues to happen, and it can continue to happen, and that we can build a sustainable system that supports people in the right way. That's why over the next year we'll be working together with all of our partners to develop a national programme to support local social care programmes and reform. As part of that programme, we'll be working with a range of partners, including local authorities, supported people and carers. Together over the next few months, we'll agree the key priorities for a refreshed implementation plan for self-directed support. And this will give a clear focus for actions that will support the implementation of self-directed support up until 2021. But the most important point I want to make today is that I believe that fully understanding your caring experiences is vital to any reform. Such a large proportion of care is undertaken by unpaid carers out in our communities, providing essential care and support for families and friends. So embedding the rights of carers to preventative support through the Carers Act is therefore an integral part of our work on reform. But importantly, so is hearing your valuable insights and unique experiences as carers, both throughout the discussions today and in the coming months for the programme, as the programme develops. In order for the programme to be well informed and reflective of real caring experiences, it's really important that we hear those experiences, and I can assure you that myself and others in the room are absolutely in listening mode today. So today's debate is an opportunity to think about what matters to each and every one of us here today, how we would like things to be done, and what changes need to be made in order to bring us closer to our goal. I strongly support the motion that carers are central to shaping the future of health and social care. I believe we all have a shared responsibility to work effectively together to develop our systems. Doing so will allow us to create and realise a vision for social care which focuses on the right things and delivers the right mix of support to ensure that it's sustainable for the future. And a system that recognises and supports carers both in their caring role and to have lives outside caring. So, having spoken about the importance of hearing carers' voices, it's important for me now to stop talking and to start listening. So it's very much over to you, and I look forward to hearing your views and experiences. Thank you very much.